if we go back to our basic biology, we might remember that peptides are just short chains of amino acids, arguably around maybe up to 50 amino acids, and they serve as signaling molecules in our body, and they're really fundamental to our biology. There's over 7,000 that we know about that exist, much less in clinical use, but they're discovering more and more of them every day, and how to make them even, more better in terms of their efficacy, their binding time, and they have so many different reasons to use them in healthcare, and they're really central to our process. They really mimic what we make naturally. And they've become really popular. Now, I'm sure most of us have heard about some of these peptides that are responsible for weight loss, like Ozempic or Mounjaro. These ones have really blown me away about how popular they've become. And if we go back even further in history, we realize that insulin is a peptide. So really, peptides have been around for a long time, but they haven't really, I would say, come to market quite well because they have some weaknesses. A lot of them are really only available as injections, and that used to worry me until Ozempic became the third fastest growing product in healthcare, $13 billion product. And so we know that the patient compliance will go up if they're getting the results that they want. But the other thing that's really great is that they have a lot of benefits. They're very versatile, like Dr. said in the introduction. You can use them in so many different ways in medicine, and they have a lot of pleiotropic effects, meaning that you might be using them for one particular reason. For example, when I found out about the peptides, I had an injury, and I was using one peptide called BPC 157, which is something that we upregulate naturally in our gut to help heal tissues in our body. And I was using it to help heal the tissues in my knee. But 2 months later, and I didn't know that this was a side effect at the time, or one of the reasons that we use it, my gut started to feel better. And that was really great for me when I was dealing with adrenal fatigue, because I had a lot of gut symptoms around bloating and food intolerances. And so that started to improve. So very different types of effects. And even with that peptide, sometimes people will say they get a cognitive benefit. And the other thing is that they're very safe. Again, they mimic what we make naturally in our body. And so they're just amino acids. They break down into their constituent parts of amino acids. So they don't have any drug-to-drug interactions. We don't have to worry if someone is on a pharmaceutical medication that there would be any interactions, because they don't break down using those CYP enzymes like drugs do. And again, they're very non-toxic. So they don't filter through the liver, the kidney, they break down into their amino acids, and they're very well tolerated with very few side effects. And they're also available in different routes of administration besides injection. We can see that there are peptides that are available orally or as a nasal spray, sometimes as a topical cream. And so there's also applications for your patients that are opposed to injections, but truly some of the really best ones are available as injection. And they have very targeted actions in the body. So they're very predictable in their outcomes too. And again, very diverse clinical applications. So what I love about this, like I said, even when I was dealing with adrenal fatigue, which can present in a lot of different symptoms, you can find something that's really going to give a great effect in your patients across many different applications. And a lot of times you can combine them to have very synergistic effects together as well. So we can see that we can address many things in a very short amount of time with really great results. And so we'll talk about some of these today, but I think it's important to really understand, why do we need peptides? And I really liked this slide, because I think we all understand that, in our modern lifestyle now, unfortunately, we are prone to a lot of insults, let's say, to our health that can result in this term that I like, called metaflammation or metabolic inflammation, or even inflammaging. You've heard of this term, where we see that all of this kind of sequela of insults can result in things like insulin resistance, oxidative stress, and even then we start to name it: cancer, cardiovascular disease, autoimmune diseases, things like this that really turn into these really chronic diseases that we're seeing so much of now. And so it's really important to go back and understand what's going on with your patient or with yourself. And I also noticed that in my experience, I've been really lucky because in the last several years, I've been able to apply a lot of these peptides clinically, also working with doctors here in Thailand in managing longevity programs for people. And when we're looking into their blood work and looking into their symptoms, we see a lot of the same complaints. And probably many of you might even be experiencing some of these things right now. Whether you're feeling fatigue, probably the most common, it's pretty common to feel fatigue, of course, or digestive issues like I said, bloating, cramping, gas or indigestion, constipation, or getting sick very frequently. This is all very common. You look across these symptoms here, and I say that most of the people that I see that come to us for a program are experiencing several of these symptoms. And so when we start a peptide program, what I really want to help everyone understand, of course, what peptides are and what they do. There's a ton of information out there, by the way. I don't share too many clinical studies on here because you can look them up, you can find them, but I really want to help you understand how to use them in a way that is going to make sense for yourself or for your patients to really do it in a process, I would say, that's going to start with the foundation. So where do we have to start? We really need to look into a baseline measurement like we would in any other functional medicine situation. We would always be trying to get as much information on our patients as we can, including that functional workup that's really going more in depth than our we say annual checkup, right? Our annual checkup only gives us so much information. We can really find out, of course, about their liver function, kidney function, CBC, things like this. And these are still really important, but we want to dig a little bit further if we can in understanding how our patients are affected by things like inflammation or even their nutrient status. Are they low in certain critical nutrients that are needed kind of to be the precursors to the production of things like our hormones, our neurotransmitters? And I also love if you can go a little bit deeper to look into things like the heavy metal and mineral analysis. That gives us some information about things that we need to address to get out of the way, or to kind of clean up or detoxify the body a bit to make it a better suitable environment to receive not just peptides, but any other therapy. And I love the urine organic acid profile also, if it's possible, if it's available for you, because we can also see things like the way that what's going on in your gut. There's not really a great blood test for that. So we can really see, is there overgrowth of bacteria? Is there overgrowth of fungus in the gut? Is there, alterations in the way that you are metabolizing the nutrients in your body? Is there mitochondrial dysfunction? This is something that's really also really important to see along the way. So of course, we want to have, beyond that information, a really thorough history for our patients, including the symptoms that they're having. So a health questionnaire is really helpful if you can have your patients fill that out and be as detailed as possible, especially when it comes to peptides, because they're so specific at addressing symptoms. And of course, the most important thing really is, what are their lifestyle habits? Because we would be remiss to think that if we just give them some IVs and supplements and peptides, that we can really change things long term. We really have to help people understand how to live healthier lifestyles, right? So addressing diet, addressing sleep, addressing fitness, addressing stress. Sometimes easier said than done. We know that it takes time to change habits over time, but this is really 75% of what we do. And so, of course, a treatment plan is always going to include all of those things. Now, like I said, in my experience of treating people with peptides and, of course, other things along the way, after looking at numerous lab results and looking at their lifestyle factors, it seems to me that our patients are really dealing with a lot of the same underlying issues. I call these the foundations, because when we look deep into it, we realize that most people are dealing with immune dysfunction, gut dysfunction, inflammation, insulin resistance, and of course, aging. This is something that is really important to address, is how can we slow aging? What are the things that we can do to turn back the clock? So what I love about peptides is there are some that fit so specifically into those conditions. And I want to share that with you today about these basic foundational products. And then I'll touch briefly on some of the other ones that are sort of exciting and biohacky. I get a lot of people that come to me that want to biohack, and they say, I heard about this senolytic peptide or this mitochondrial peptide. And I usually say to them, hang on, let's go back to the foundation. Let's find out what's going on, because if we don't address these things first, sometimes when you get to these, kind of fun biohacky or popular therapies, either you don't feel well when you get them or you don't get the results that you want. So that's why we like to go back to these foundations and address these initially. And so there's no better peptide to start with than probably my favorite peptide, one that I use personally when I initially was trying to get myself out of adrenal fatigue, and that's thymosin alpha-1. Now, you might recognize thymosin alpha-1 because it's approved in over 35 countries and under the trade name Zadaxin. And thymosin alpha-1 can be used in so many different applications, but ideally what it's used for is modulating the immune system. And so it's a fragment of what our thymus makes naturally. And I remember that our thymus starts to involute after about the age of 17. And so we see aging of our immune system over time as well. But thymosin alpha-1 will stimulate a lot of these really great cells, like our natural killer cells, for example. We see also improvement in CD4, CD8 ratios. We see that patients that have chronic fatigue can really benefit from this, or if they're too much in the inflammatory side, then we can see that they're able to shift more into that Th1 version of the immune system. If they're too much in that Th2 kind of inflammatory side, it starts to modulate the way that the immune system is functioning. And in the studies on this product, we see that in about 12 weeks, we can see an increase in natural killer cells. Now, it may take a little bit longer than that if your patient has something like cancer. Like I said, my history is working in cancer, and so I'm keeping in touch with the doctors that are treating cancer, and we see that it can take much longer to address the rise in natural killer cells when someone has a chronic condition. So my advice there is just try to keep using it. This is a peptide that you can use continuously. It's dosed at 1.6 milligrams twice weekly. So even now, the studies that are coming out about using thymosin alpha-1 after the pandemic, they're seeing that the decrease in the mortality is really improved with the use of thymosin alpha-1, because it's helping to reduce inflammation and stimulating all of these immune cells. And you might even consider this in autoimmune conditions as well, or even in preventing viruses or recurrent bacteria, for example. I have a lot of guys here that like to train in the Muay Thai camps in Thailand, and they get constant staph infections. And so one of the things that I see is that when we start them on thymosin alpha-1 at that twice weekly dose with another product that we'll talk about today called BPC 157, we don't see recurrent staph. It suppresses that. Even in things like herpes simplex virus, we can see that they're not getting common outbreaks as they were before. And even sometimes thymosin alpha-1 is used as an adjunct to vaccines as a way to help the efficacy of the vaccines as well. So anyone that really has any underlying immune dysfunction or immune senescence, as we say, as the aging of the immune system, you can consider using thymosin alpha-1, 1.6 milligrams twice weekly. And by the way, in terms of side effects, there was more side effects in the placebo group in the studies and than the control group on thymosin alpha-1. So it's an extremely safe peptide. I've even given it to my daughter. Now we expect, that our children should have quite a well-working thymus gland. And I wasn't really sure about the use in children because I haven't seen any data on it. But I will share with you that personally, I was comfortable to give my daughter an injection of the thymosin alpha-1. She was 15 and she was starting to get quite sick one day. And I used a 1 milligram dose for her. And the next day she was up and ready to go to school. And my experience with it personally was when I used it for adrenal fatigue, I actually didn't know how to use it at the time. I was given it it was given to me by a friend of mine who was using it. He was quite an older gentleman who was using it to prevent COVID. And when I didn't know how to use it, so I was using it every day, which in the studies we see very high doses. And on the 5th day, I had experienced a clarity that I hadn't had in almost 3 years of dealing with this, with the symptoms around adrenal fatigue. So I'm going to skip past this one right now because you can find a lot of information online and look at the studies on thymosin alpha-1. They are robust. And again, the applications are wide for thymosin alpha-1. So I like to skip to the other thymosin product, which is also a fragment of our thymus. And it was originally discovered at the Albert Einstein College of Medicine, like thymosin alpha-1. But this is a 43 amino acid peptide, thymosin beta-4, that we upregulate naturally when we have an injury. Now, this peptide is really, you can think about repair. It will have some immune benefits, and decreasing inflammation is also one of its properties. But really what we see is aggregation of stem cells to an area of injury to promote healing, and even stimulation of angiogenesis to promote better blood flow to an area of injury. And really, you can use this in so many different applications. Again, it's up for FDA approval right now for treating condition of the eye. But in general, you could use this in conditions. There's been tons of studies on this in conditions like TBI and stroke. Even though it's a larger amino acid, we see that it crosses the blood-brain barrier. You can use it in fibrosis of the kidney or the liver or the lung. And lots of studies have been done on this product post-MI as well, as a way to regenerate the function of the heart. In general, you might consider using this either 500 micrograms, as little as 500 micrograms a day for 30 to 60 days, or as a 1 milligram injection for 30 days in acute injury. Now, this can vary from person to person in terms of, how long that they need to use this. What I find is that in acute injury, 1 milligram a day for 30 days, together with the next product that I'll talk about, BPC 157, really hits home. I haven't ever had more than 2 people in 3 years who have needed a second month of BPC 157 for an acute injury. And that was because one guy had a laminectomy and, a back surgery. And he said, I feel better. I'm up walking. My pain is gone, but I want to make sure it's gone. Can I do a second month? And he had no risk factors or any reason to not continue this peptide another month. So we carried on. And after that, he said he had experienced healing like he hadn't imagined. The stories of this are robust in terms of its efficacy and ability to help repair, and very safe. Again, I would probably consider not using this in a patient that has a history of cancer, although there's no studies that show that it promotes the growth of abnormal tissue, but because it's considered a growth factor. And unfortunately, professional athletes cannot use this product because it's also restricted by WADA or USADA. Okay, so together with BPC 157, thymosin beta-4 is called, this combination is called the Wolverine stack. So you might have heard that before. I want the Wolverine stack. And that's because of its ability to promote healing rather quickly. And BPC 157, we could go on and on about the effects of this product, but just very quickly, it's one of the peptides that we upregulate naturally in our gastric juices. And we do so to help heal the lining of our gut. It's 15 amino acids, but we see that it has ability to repair tissue all over our body. And so I'm going to skip through some of these things, but really any bone, tendon, ligament damage, we can see again that acute dosing, 1 milligram for 30 days can really help as an injection to help heal those tissues. If you have a gut issue, you would consider using this as an oral peptide. It's stable in gastric juices and helps to help heal the lining of the gut. Like I said, so any gut symptom really that you can imagine, you can use BPC 157. I'm going to run through quite quickly because we're getting close on time. We have about 7 minutes left, so I want to make sure that we get to our other foundational peptides, and then we can go back and answer questions. But MOTS-c is another one of my favorite foundational peptides. Why? Because we're seeing a lot of patients that are dealing with insulin resistance, right? So really, if we're looking at fasting glucose and hemoglobin A1C or fasting insulin, and we're seeing elevation in fasting glucose, over 80, 85, our A1Cs over 5, fasting glucose over 5, right? We're starting to see that these are early indications of insulin resistance, or probably already starting to see some insulin resistance. And MOTS-c is one of these peptides that we upregulate naturally in our mitochondria. So this is truly a mitochondrial peptide. A lot of people like this for anti-aging, but we see that we upregulate it when our mitochondria sense metabolic stress. So we can see improved insulin sensitivity and even stimulation of AMP kinase. So this is another favorite of people that are training and want to improve their performance because they see improvement in endurance when they use MOTS-c. And again, another very anti-aging pathway. Some of the applications of this would also be around weight loss. We see that in the studies that they've done on mice, that when they fed them a high-fat diet and treated them with MOTS-c, they did not gain weight like the other group. And so this is a great alternative to some of the other GLP-1 type peptides, like I mentioned before, Ozempic and semaglutide, that come with a host of side effects. People experience nausea with those products. They can have constipation because it works by delaying gastric emptying. But if those products aren't suitable for your patient because they're experiencing those symptoms, you can consider using MOTS-c to address insulin resistance. I love this product. People feel really great when they're on it. 10 milligrams once weekly is enough to address the insulin resistance. If you have an athlete, you might consider 5 milligrams 2 to 3 times weekly in the morning before they train, and they'll talk about in extra endurance and getting through their workouts. Now, the last foundational peptide that I want to talk about is the growth hormone peptides. We know that growth hormone is one of these things that we can address early on in our patients. I think the best application for this is actually addressing sleep. But of course, this is one of the ways that we can also address aging. Growth hormone naturally declines as we age. And of course, there's argument whether having good IGF-1 or low, is low IGF-1 bad, is high IGF-1 bad. We want to maintain a homeostatic type of IGF-1. So bringing them back to a therapeutic baseline. And what I like about the peptides for treating growth hormone is that there's a negative feedback loop. So we don't see that IGF-1 is driven too high. You won't get very high IGF-1 with peptides, but you can bring them to a really therapeutic level by stimulating these receptors at the pituitary, the growth hormone releasing hormone, and the ghrelin receptor. And so a very common combination that we see is the combination of CJC 1295 and ipamorelin to promote better secretion of the growth hormone and release of the growth hormone. And you can cycle these anywhere from 3 to 4 months on the CJC 1295 and ipamorelin. And then you can also use another product called tesamorelin, which is already FDA approved under the trade name Egrifta. Tesamorelin is potent enough to stand on its own. You can use about 1 milligram with that product and see a significant increase in IGF-1 quite quickly after starting it. But tesamorelin also has some other benefits, like decreasing visceral fat. It's actually FDA approved for treating visceral adiposity that the patients that have HIV can develop from the side effect of their medications. So we see decrease in fat around the midsection. So a lot of people really like this to promote better muscle growth and decrease in fat. And also one important thing to note when you're using the growth hormone peptides is it's really important to be fasting when you're injecting them. So try to get your patient or try to fast for about 3 hours prior to injecting it at night. And if you can't inject it at night because you've eaten late on accident, you had a snackcident, let's say, you can inject it first thing in the morning and wait just about 40 minutes because the half-life is relatively short on these products. There's also an oral option for the growth hormone, but I would use that one with caution in someone that's trying to lose weight because this is called MK677, or ibutamoren is the other name for it, because it makes them hungry because it's hitting that ghrelin receptor. And so you don't see that with ipamorelin, but definitely with the MK677, with the oral version, you might experience hunger in your patients. Okay, I'm looking at the time. We have 2 minutes, so I'm going to
take a minute, Nikki, and then maybe we'll for a minute we'll take the question. So you have 1 more minute.
Yep. Okay, great. I just want to mention that, of course, these are very foundational things that we can consider in our patients at the beginning. And yes, you can combine them all together to create a treatment program that's going to be anywhere from, I'm going to skip down to a example patient who was experiencing fatigue and wanted to improve his performance in work and in his workouts, and lose fat. And he's also interested in longevity. And so a very common combination that you can use at the beginning is these products, like I just mentioned, that are really going to promote better decrease in inflammation and improvement in immune function right at the beginning, and address the insulin resistance and the performance and the aging all at the same time.